Join Drs. Savanah Craig and Ronnetta Sartor as we navigate life beyond graduation. Real conversations about forging our own paths in our early years, in our careers. There's a reason it's called practicing dentistry. Hello and welcome back to Beyond Graduation with Dr. Craig and Dr. Sartor. This week we are talking about patient expectations.
Yeah, this is a great topic, and it's very important for managing patient expectations. So many things come to mind. What about you?
The hardest part of my day is this piece.
So true.
I can do the teeth. It's the patient that's the challenge.
Very true.
So all right, I'm a new patient in your practice. When does managing my expectations start, in your opinions?
I think it starts, as soon as the patient's in the chair, we discuss what their goals are. I think we live in a society now where, you can have Instacart dropped off at your home and you can have something ordered and dropped off within a day of ordering it. And especially for more extensive and complex cases in dentistry, you don't and you shouldn't just right off, from that first appointment create a treatment plan unless it's, something very straightforward. For more complex cases, it's okay to tell the patient, hey, would you mind coming back for records so that we can, get additional photography, get additional molds so that I can, actually sit down and study your case and, be able to provide you with the best care that I think, we together deem necessary. And sometimes you just cannot do that in, a 30-minute interaction with the patient.
Yeah.
Especially on more complex cases. So I think for a lot of complex cases and, even not super complex, but, even if it's an aesthetic case, but, they're healthy otherwise, it's more so setting the expectation that, okay, we're not going to rush and do this. We're going to take the time to study it and make sure it's done right so that whatever we do lasts as long as it can potentially last.
What about, patients in pain and, there's just so many fires to put out. What's sort of your thought that way? Or how do you approach that patient?
I think a lot of it depends on, the patient. And so if they come in and they have one chief area of concern, we can address that chief area of concern in terms of it being, pain or an emergent type situation. And then if they have other fires to put out, like you said, we do a plan of attack to address those so that we can move on to, comprehensive type dentistry once all of the emergent care is out. What about you?
Yeah, I think it's been, obviously this has changed since dental school and even since residency, like trying to, be efficient for everybody. And, okay, number 19 is in pain, but also there are a couple of fillings in that same area. You'll be numb, let's try to take care of that. And focusing on, I don't know, active disease, whether that be pain and infection or caries or perio. And then I've had a couple of patients where immediately they're like, well, how are you going to replace that tooth? And I'm, listen, we got to get everything else under control, and it might take a while, and then we can talk about replacing teeth. And I mean, patients don't always like that approach, but those are like the conversations that I struggle with a lot, to just be like, listen, if I put anything else in here, it's not going to last because we've got other things we need to deal with.
Yeah, at our office, we've started taking a more holistic approach. So we have like a form that we have the patient fill out, and it has on one side of it all of the things from a dental perspective that they self-report. So, for example, like broken teeth or sleep apnea or clenching and grinding their teeth or acid reflux. And then on the other side of the form, it has how those oral problems have, implications in the rest of the body as well. And for us on our team, it's been very helpful to have more meaningful discussions with patients, to have them value and take as much responsibility for their oral health as we are. And so I think it's setting different expectations that, okay, the mouth is a part of the body, but it's also, it's a gateway that tells you about other health issues that you can be having. So we're having, more meaningful conversations about, okay, well, you have sleep apnea, or you have signs that would let us, think, or, put you at high risk for potentially having it. I think you should have a sleep study done. Or you have acid reflux and, it's been untreated for so long, and this is how it's impacting your dentition, but, that's impacting your everyday life as well. So, all things are connected.
What a shocking discovery that your mouth is a part of your body. It's really unfortunate that we as a society have separated them. Like it blows my mind every day, but that's a topic for another time. um I think the most interesting, and I haven't figured out a good way to figure this out yet. Obviously I'm very early into this whole thing, but patients come in, just tons and tons of problems. My so-and-so is getting married next week. Can you fix everything? And crazy things of like, they come in December 1st and they need everything done by the end of the year because their insurance is going to run out. And I just don't know the tactful way to be like, why today? Like, this has been a problem for at least a few months, if not years. Why? What made you call the office today and show up for an emergent new patient exam and decide that everything, that you think I have this magic wand that I can fix years of problems by the end of the week? I'm sure you have these patients as well. Have you figured out a way to get that out of them? Am I approaching it the wrong way?
No, I think for a lot of patients, especially patients that know that they need a lot of dental work done, a lot of guilt and shame can come up at, those initial appointments. And so before I even get into, hey, we can't fix all of this like right now, I let them know how happy I am that they made the first step and scheduled the appointment, and they're in the right place, and they're doing right by themselves by taking the first initial steps. And then from there, we just have a discussion in terms of what's important to them, in terms of their goals and how we can get there. And a lot of times, it's almost like it's kind of off topic a little bit, but if you think about like weight loss journeys and that sort of thing, well, if you gained a bunch of weight, you didn't do it overnight, so you're not going to lose it overnight. And that's kind of the same thing with dental health too. Like, the cavities didn't form overnight, and so it's unrealistic to think that just overnight we can have everything fixed. But we can definitely work on it and address the things that are major concerns. So I guess to answer your question, it's not like I don't have a magic, um, expression or line that I say to patients. A lot of it just happens organically once I hear what their, um, you know, chief complaints are.
Yeah. And I think that's good that you're, approaching that from such a place of compassion and like I think people have internalized, like you said, that shame and reminding them that, hey, at least you're here now. We've got some problems to tackle, but you're here now. So that's really good advice. I think the other piece, and human psychology is bananas, but figuring out how do you get the patient to take responsibility, because I think there's a fine line between figuring out how we ended up in this situation so that the work that I do is going to last, but also not putting more shame on the patient. Because I do think, at least in my practice, a lot of it is just like ignorance, unfortunately. You know what I mean? Everyone in their life has lost their teeth at this age or whatever,
Well, I try to spend a good amount of time educating the patients on, okay, here's what I'm proposing that we do. But like, for example, that patient that has acid reflux, or, that patient that potentially has, or, we think they have obstructive sleep apnea, but they haven't had a sleep study done. Those are patients that I urge them, before we do any major type work, that they go and have those things assessed before we get started. And then I explain to them, if we don't address it, how that will impact them from a dental standpoint, and that regardless of what I put in their mouth, they likely will destroy it. And then, yeah, that's why it goes back to education, but also setting the expectation that, okay, we have a bigger issue that's going on that has potential to, ruin your dentition. Even if you spend thousands of dollars trying to fix it, if you don't fix the bigger problem or address the bigger problem, then there's pretty much nothing that I can do. And, they have to own that pretty much we had the discussion. If you decide to not have those things addressed, then to some extent, especially if it's something that they want that's aesthetic, that's not a necessity, and they're not in pain, that's when it's on us, because it's our license on the line to, tell that patient, okay, well, I don't feel comfortable providing this treatment in this scenario. And in some cases, sometimes if a patient's expectation is way on the other end of the spectrum, and, you've tried to make those explanations, sometimes they might be better served in another practice.
Yeah. Sometimes no treatment is the best treatment.
For sure.
Yeah, that's a really good point there. And I am famous for, the teeth, the good Lord gave you didn't last. Why do you think I can do better?
Uh-huh. Very true.
That sinks in for people, I think, sometimes.
Well, I was going to ask, how do you address those situations?
Yeah, I think just trying to explain the limitations of, the situation that we're in. And like I said, I can't, anything I'm putting in there is man-made. It's, unfortunately, nothing lasts forever, especially in your mouth and especially under unfavorable conditions. And I think a lot of days in dentistry we're making compromises, and I'm just very, very clear with the patient of like, what compromises, what risks are you willing to take on, and not letting them pressure me into things that I'm not comfortable with. I can think of a patient that really wanted an immediate implant, and I knew there wasn't enough buccal plate for this, and I was like, it's going to be several months of healing with the graft, and then the implant is placed and that heals for several months, and they were like, well, I heard somewhere else they can do it, blah blah blah. And I was like, that's fine, there might be, but this is my training, and these are my this is what I'm willing to do. And if you're unhappy with that timeline, your mouth, your choice, all good. No harm, no foul here. It's just my job to let you know what I am comfortable doing, what is possible in my hands. And as long as you're okay with, just not letting them force you into things to be the savior, because the moment you push yourself outside of your bounds, those are the sticky situations. And conveniently people forget that you're like, I told you I didn't want to do this, and that definitely doesn't stand up in the court of law.
Yeah, I think documentation is key, especially when we're having these tough educational and expectation discussions with patients.
Yeah. And I think it's become so, I don't know, it's super rewarding when you explain things to patients, and I really take a long time to educate them, because it's amazing how little the general public knows about what we do. You know what I mean? It's kind of humbling in some ways. But yeah, you just gotta, at the end of the day, if I've said my piece and you take a little bit of information home, even if you decide that I'm not the dentist for you, I can sleep at night,
And then now remember the discussion that you had if and when it doesn't work.
Yeah. Those are, when they come back and they're like, well, I went for a second opinion and I liked what you said better. And you're like, well, glad you tried, I guess. Yeah, the sedation course that I went to, they were reminding us, dentistry is so unique in that, especially in, sedation, for example, you're sort of on an island, for better or for worse. In a hospital setting, you've got, a code team, you've got backup where, I've trained my staff, but if something really goes sideways, it's on me. And so they were like, you're the pilot of the plane, and you only fly in clear blue skies, don't take on more than, you're comfortable with. And I feel like that, is definitely true in sedation, but in so many other aspects of what we do is just remembering, for better or for worse, it is sort of all on your shoulders in a way. Not to make that a scary thing, but
I think that's an excellent way to wrap this episode up.
Alrighty. Catch us back next week for more Beyond Graduation.
Thank you for joining us for this episode of Beyond Graduation. If you enjoyed this week's episode, be sure to share it with a friend. Connect with us on social media at Savanah Craig DDS and at Dr._Sartor. And remember, you are not alone on this journey.